Entering a new patient initial evaluation. From the appointment book, right-click on the patient name and click Go to Patient. Click the green tab Service in the middle of the screen. Click on New in the gray menu just below this green tab. Observe a patient player appears at the bottom of the screen named New Service for Shannon Persons. Click the top blue tab Protocols. In the left navigation pane, click Charting. In the left navigation pane, click Doctor Portal. Click New Patient Evaluation. A green icon called Automated Patient Evaluation will populate the gray area of the screen. Click the Automated Patient Evaluation icon and Add to Service in the top toolbar, or click and drag the icon into the patient player at the bottom. Click Save and Play in the bottom gray menu of the patient player. Observe now there are 4 icons in the left navigation pane. 1, 2, 3, 4. Each of these icons represent a section of the patient visit. Summarize risk factors from the new patient paperwork. This patient has a pacemaker and cardiovascular disease. Click Next. Summarize complaint history from the new patient paperwork. This patient has been in a work accident and fell on their side. The symptom is their neck is sore, and the past treatment is an anti-inflammatory by MD. Click Next. Click the box that corresponds with the body area of the complaint. We will choose neck. See on the left a new icon has been pulled in. SOAP 1 of 2, neck. This is the subjective and objective part of your notes. Click Next. Fill in the complaint. This is the only complaint, so it is number 1. The type is pain. The location is neck, left side. The progress is worse, and it's radiating to the right of the shoulder. The quality is acute, with an intensity of 7 out of 10. The asymmetry listing is at C5 and C6, and palpation reveals tenderness of neck and right shoulder. Spasm of right upper trapezius, and we will call in our first orthopedic test as the foraminal compression. Observe, a new icon is added to the left navigation pane named foraminal compression. We will also select a neck range of motion test by clicking the box. Observe, another new icon is added to the left navigation. Please note all items in green font are linked to other modules. We refer to this as anchored. Click Next, and the neck range of motion test will be the next screen. We will put in active flexion at 80, active right rotation at 75, and active left rotation at 60. Click Next. The foraminal compression test will be the next screen, and this will be a positive test. Click Next. The last module is labeled SOAP 2 of 2. This is the assessment and plan. This is the acute phase. Patient work status is off work. Their activity of daily living is moderately affected. The patient has not been referred out, leaving the NA in that box as our option. This will prevent the entire question from printing in your notes, maintaining only pertinent data. Short-term goal 1 is pain will decrease. Short-term goal 2 is range of motion will increase. Click Close and your initial evaluation is complete for this patient. Observe the charting module icons are now displayed on the bottom right of the screen, while the date of service is posted and selected immediately to the left.